Hey guys, it's Whitney, your family practice PA here, and today's video is a really common topic that I talk about with a lot of my patients, and it's if you're a type 2 diabetic or pre-diabetic, what in the world am I supposed to eat to actually get my numbers good? So let's get into it, break it down. What foods are good foods? What foods should you avoid? Why? I mean, that's where it's like, why can't I have this? Why should I have this? And then kind of really still do a quick review of the numbers of what those labs mean and everything. So without further ado, let's break it down. So diabetes, type 2 diabetes is usually later on in life. So autoimmune is type 1, so it's completely different disease type. So we're going to focus on type 2 diabetics today. And we kind of broke down in my video about why I don't understand my diabetes video, so you can check that out for more information. But just quick overview. A1C, hemoglobin A1C is a 3-month average of your glucose, what your sugar levels are when we check them. And so 5.7 to 6.4 is considered pre-diabetes. So it lets us know we're trending towards diabetes. We really need to watch our sugar intake, our carb intake, all of those things before we get into full diabetes and start talking about treatments and different things. So 6.5 and above is the diabetic range. To let you know, some people understand like their fasting glucose numbers a little more when you stick your finger or right when we get that blood draw. So those numbers we want it under 100 for the normal range. And pre-diabetes is 100 to 125. And 126 and above is the diabetic range. So just quick overview. I go into it a lot more detail in that other video, so you can see that on my channel. You know, if you're getting anything out of this, please hit that subscribe button. I'm gonna have continuous updates and videos coming out. And then would love for you to hit that like button, leave me a comment below on anything that content you would like to see come out. So, but getting back to the topic today, really wanting to break down the diet. So one of the worst things that we can have as diabetics is that we eat too many simple carbohydrates. So simple carbs. So those are our pastries, our, breads, like our white breads, our sweets, our candy, our sodas that have sugar in it, all of those things. And what happens is as soon as we ingest those, our body produces our glucose levels go shooting up on us, tries to produce that large wave of insulin. Insulin's what our body produces when glucose hits the blood. And the insulin's trying to get it into the muscles, into the cells, get rid of it. So when that happens over repetitive periods of time, our insulin production from the pancreas tires out. So what we want to do is really limit those simple carbs. Okay, so that is what is shooting up those sugars. So our unhealthy fats can do that as well. So that's our fried, greasy foods, our breaded foods, things like that are really, really bad, detrimental from a glucose standpoint, from a diabetes standpoint. So we want to limit those as much as possible, make them a treat. Some people just need to cut them out of their diet depending on what your sugar levels are. So for a lot of my patients, I tell them really none of their sugar or their calories should be coming from their drinks. So there's no reason to be drinking full soda, regular Coke, regular Mountain Dew, regular Sprite, all of those. Just really don't, if you're a diabetic, really anybody, but my diabetics especially. So we're going to get enough carbs and sugars from our diet. So really watch that drink intake. So, but getting back into that. So the foods that we really want to focus on with diabetics is we want to have those complex carbs. So those are our whole grains, our legumes, which is like our beans, our peas. It is, like I said, the whole wheats. It is brown rice, not white rice. It's trying to get vegetables more, so you can have your carrots, your green beans. You can get some of the natural sugars through fruit. I don't want you to go crazy with fruit because fruit still has a lot of sugar in it. It's natural sugar, which is better than the simple sugars. But definitely if you want that little bit of sweet something and still get that sensation and kind of get that sweet tooth, fruit is okay. It's our low fat dairy. So you can have a low fat milk, a low fat yogurt. cheese, all of those. So those are all more from our carb standpoint. We wanted them to be those complex carbs. So I really like how the American Diabetes Association does it. So it's the ADA, and they have the My Plate method. And so when you look at it, you have your plate, and half of it needs to be a non-starchy vegetable. So those are our carrots, our green beans, our salads, our spinach, all of those. That should be half the plate. A fourth of the plate can be our complex carb. So that can be our brown rice, our legumes, so you can have some peas or some or beans or something along those lines. And then the other last fourth of it should be a lean protein. So it can still be a red meat, but just make it a less fat cut of a meat. So it can be like more of you just can skim the fat off of it. But really, chicken, fish, turkey are always going to be our staple. And then you can add some healthy fats to that. So that can be with our olive oil, our high fiber fruits, our nuts, all of those things. And then making sure that we're not getting those extra calorie sugar intake from our drinks. So having water, having iced tea, something along those lines. But if you stick to those methods where most of your sources are coming from a lean protein, those healthy fats, which is great for cardiovascular health. I'm actually going to do a video next on what to do with high cholesterol, like what foods you should try to incorporate in your diet and what foods you should limit. But those healthy fats are great for our heart. They're great for my diabetics, because we're making the body work harder and we're not having those huge rushes in glucose levels. So when we eat those simple carbs, you get that huge sugar rush and then you plummet. So one, it's horrible for our energy levels. Two, it's horrible for our sugar, our glucose levels. Over time, it's going to tire out our pancreas where it's not producing the insulin. And then that's when we start having to actually give the insulin injections for treatments for my diabetic patients. So, which is a great drug when we need it, but we want to save that for last resort. So we want our body's natural production of insulin to stay up. So all of these things, eating that healthier diet, not causing those sugars, letting the medication, staying on oral medications and doing their job is always going to be the ideal scenario. So we just really want to focus on that. If you have any questions, please leave it in the comments below. I answer these questions every day in my line of work. Like I said, I worked for 8 years in family medicine as a PA. Urgent care and family medicine. So love diabetic information. I think there's so many incredible treatments. I love preventative medicine, getting it out there, getting people educated. I want people to understand their numbers, know what they mean, what are ways they can take control of their health, and really dive into it. I have some videos on some of the newer like injectable diabetic medications that also come with weight loss. So check those out. Medicines like semaglutide, which is Ozempic, Wegovy, Rybelsus. Also have a video on Mounjaro, which is the newest one. So let me know what you guys want to know more about. Can't wait to see it. I'll see you on the next video. Thank you.